ProPublica is doing some amazing work in documenting these deaths of women that shouldn't have happened because of these forced birther states and these bans. So this one might move some needles, I'm not sure. But up until this point, the first three women that they documented were, the first two women were Black women. The second woman was a Latina woman. But this one is a young or was a young white teenager. So this mom is a forced birther mom. She and her daughter were pro-life up until her own daughter was crashing and then she needed some medical intervention. But let's get into this article from ProPublica. It's a long one. It might require 2 takes. A pregnant teenager died after trying to get care in 3 visits to Texas emergency rooms. It took 3 ER visits in 20 hours before a hospital admitted Nevaeh Crain, 18, as her condition worsened. Doctors insisted on 2 ultrasounds to confirm fetal demise. She's one of at least 2 Texas women who died under the state's abortion ban. These are the authors if you want to look them up. Candace Fetal screamed for someone in the Texas hospital to help her pregnant daughter. Do something, she pleaded on the morning of October 29th, 2023. Nevaeh Crain was crying in pain, too weak to walk, blood staining her thighs, feverish and vomiting the day of her baby shower. The 18-year-old had gone to 2 different emergency rooms within 12 hours, returning home each time worse than ever. The first hospital diagnosed her with strep throat without investigating her sharp abdominal cramps. At the second, she screened positive for sepsis, a life-threatening, fast-moving reaction to an infection, medical records show. But doctors said her 6-month fetus had a heartbeat and that Crain was fine to leave. Now on Crain's 3rd hospital visit, an obstetrician insisted on 2 ultrasounds to confirm fetal demise, a nurse wrote, before moving her to intensive care. By then, more than 2 hours after her arrival, Crain's blood pressure had plummeted and a nurse had noted that her lips were blue and dusky. Her organs began failing. Hours later, she was dead. Fales, who would have seen her daughter turn 20 this Friday, still cannot understand why Crain's emergency was not treated like an emergency. It's because you live in Texas, and Texas has decided that it is perfectly fine for a woman to die. They even went to the Supreme Court to say so. You have to know what you voted for. But that is what many pregnant women are now facing in states with strict bans, doctors and lawyers have told ProPublica. Pregnant women have become essentially untouchables, said Sarah Rosenbaum, a health law and policy professor emerita at George Washington University. They can't help them. And this is what these forced birthers don't understand. Texas's ban threatens prison time for intervention that end a fetal heartbeat, whether the pregnancy is wanted or not. It includes exceptions for life-threatening conditions, but still, doctors told ProPublica that confusion and fear about potential legal repercussions are changing the way their colleagues treat pregnant patients with complications. In states with bans, such patients are sometimes bounced between hospitals like hot potatoes, with healthcare providers reluctant to participate in treatment that could attract a prosecutor, doctors told ProPublica. In some cases, medical teams are wasting precious time debating legalities and creating documentation, preparing for the possibility that they'll need to explain their actions to a jury and a judge. Dr. Jody Abbott, an associate professor of obstetrics and gynecology at Boston University School of Medicine, said patients are left wondering, am I being sent home because I'm really okay? Or am I being sent home because they're afraid that the solution to what's going on with my pregnancy would be ending the pregnancy, and they're not allowed to do that? There is a federal law to prevent emergency room doctors from withholding life-saving care. Passed nearly 4 decades ago, it requires emergency rooms to stabilize patients in medical crises. The Biden administration argues this mandate applies even in cases where abortion might be necessary. No state has done more to fight this interpretation than Texas, which has warned doctors that its ban supersedes the administration's guidance on federal law. They can face up to 99 years in prison for violating it. That is what women are facing in Texas. These doctors can let them die because the law says so. ProPublica condensed more than 800 pages of Crain's medical records into a four-page timeline and consultations with two maternal fetal medicine specialists. Reporters reviewed it with 9 doctors, including researchers at prestigious universities, OBGYNs who regularly handle miscarriages, and experts in emergency medicine and maternal health. Some said the first ER missed warning signs of infection that deserved attention. All said that the doctor at the second hospital should never have sent Crain home when her signs of sepsis hadn't improved. And when she returned for the third time, all said there was no medical reason to make her wait for 2 ultrasounds before taking aggressive action to save her. This is how restrictions unalive these women, said Dr. Dara Cass, a former regional director at the Department of Health and Human Services and an emergency room physician in New York. It is never just one decision. It's never just one doctor. It's never just one nurse. While they were not certain from looking at the records provided that Crain's death could have been prevented, they said it have been possible to save both the teenager and her fetus if she had been admitted earlier for close monitoring and continuous treatment. There was a chance Crain could have remained pregnant, they said, if she had needed an early delivery. The hospital was well equipped to care for a baby on the edge of viability. In another scenario, if the infection had gone too far, ending the pregnancy might have been necessary to save Crain. Doctors involved in Crain's care did not respond to several requests for comment. The 2 hospitals, Baptist Hospitals of Southeast Texas and Christus Southeast Texas St. Elizabeth, declined to answer detailed lists of questions about her treatment. Fales and Crain believed Smomortian was morally wrong. The teen could only support it in context of grape or life-threatening illness. She used to tell her mother that she didn't care whether the government banned it, just how their Christian faith guided their own actions. So this is what she wanted. So she died morally in alignment with her own beliefs, and her mother lost her daughter, but it was in alignment with God's will. When they discovered Crain was pregnant with the girl, the 2 talked endlessly about the little dresses they could buy, what kind of mother she would be. Crain landed on the name Lillian. Fales could not wait to meet her, but when her daughter got sick, Fales expected the doctors had an obligation to do everything in their power to stave off a potentially deadly emergency, even if that meant losing Lillian. So Mom was willing to compromise her morals to save her own daughter. Isn't that crazy? In her view, they were more concerned with checking the fetal heartbeat than attending to Crain. Yes, that's what Texas is doing. They care more about the fetus than the woman carrying the baby. I know it sounds selfish, and God knows I would rather have them both, but if I had to choose, I would have chosen my daughter. Yes, this is what women need, the choices. Women need the choices with their doctors, but people like Fales and Crain decided they're morally superior in their beliefs until their beliefs match up with the reality of what is going on in women's health care. I'm in a lot of pain. Crain had just graduated from high school in her hometown of Vidor, Texas, in May of 2023 when she learned that she was pregnant. She and her boyfriend of 2 years, Randall Broussard, were always hip to hip, wrestling over vapes or snuggling on the couch watching vampire movies. Crain was drawn to how gentle he was. He admired how easily she built friendships and how quickly she could make people laugh. Though they were young, they'd already imagined starting a family. Broussard, who has 8 siblings, wanted many kids. Crain wanted a daughter and the kind of relationship she had with her mom. Earlier that year, Broussard had given Crain a small diamond ring, a promise that I will always love you. Here's the boyfriend and the mom, the teenager's mom, together, and I will continue this in a part 2. So I'm continuing the conversation about the ProPublica article, A Pregnant Teenager Died After Trying to Get Care in 3 Visits to Texas Emergency Rooms. I left off with talking about her boyfriend, Randall, who had just given her a small promise ring, saying that he will always love her. Okay, back to the article. It says, on the morning of their baby shower, October 28th, 2023, Crain woke with a headache. Her mom decorated the house with pink balloons, and Crain laid out Halloween-themed platters. Soon, nausea set in. Crain started vomiting and was running a fever. When guests arrived, Broussard opened gifts, onesies, diapers, and bows, while Crain kept closing her eyes. Around 3 p.m., her family told her she needed to go to the hospital. Broussard drove Crain to Baptist Hospitals of Southeast Texas. They sat in the waiting room for 4 hours. When Crain started vomiting, staff brought her a plastic pan. When she wasn't retching, she lay her head in her boyfriend's lap. A nurse practitioner ordered a test for strep throat, which came back positive, medical records show. But in a pregnant patient, abdominal pain and vomiting should not be quickly attributed to strep, physicians told ProPublica. A doctor should have also evaluated her pregnancy. Instead, Baptist hospitals discharged her with a prescription for antibiotics. She was home at 9 p.m. and quickly dozed off, but within hours, she woke her mother up. "Mom, my stomach is still hurting," she said into a dark bedroom at 3 a.m. "I'm in a lot of pain." Fales drove Broussard and Crain to another hospital in town, Christus, Southeast Texas, St. Elizabeth. Around 4:20 a.m., OBGYN William Hawkins saw that Crain had a temperature of 102.8, an abnormally high pulse, according to records. A nurse noted that Crain rated her abdominal pain as a 7 out of 10. Her vital signs pointed to possible sepsis, records show. It's standard medical practice to immediately treat patients who show signs of sepsis, which can quickly overtake and unalive a person quickly, medical experts told ProPublica. These patients should be watched until their vitals improve through tests and scans. The goal is to find the source of the infection. If the infection was in Crain's uterus, the fetus would likely need to be removed with surgery. In a room at the obstetrics emergency department, a nurse wrapped a sensor belt around Crain's belly to check for the fetal heart rate. "Baby's fine," Broussard told Fales, who was sitting in the hallway. After 2 hours of IV fluids, 1 dose of antibiotics, and some Tylenol, Crain's fever did not go down. Her pulse remained high, and the fetal heart rate was abnormally fast, medical records show. Hawkins noticed that Crain had strep and had a urinary tract infection, wrote up a prescription, and discharged her. Hawkins had missed infections before. 8 years earlier, the Texas Medical Board found that he had failed to diagnose appendicitis in one patient and syphilis in another. In the latter case, the board noted that his error may have contributed to the fetal demise of one of her twins. The board issued an order to have Hawkins's medical practice monitored. The order was lifted 2 years later. Hawkins did not respond to several attempts to reach him. All of the doctors who reviewed Crain's vital signs for ProPublica said she should have been admitted. "She should have never left, said Elise Boos, an OBGYN in Tennessee. Cass, the New York emergency physician, put it in starker terms. When they discharged her, they were pushing her down the path of no return. "It's bullshit," Fales said as Broussard rolled Crain out in a wheelchair. She was unable to walk on her own. Fales had expected the hospital to keep her overnight. Her daughter was breathing heavily, hunched over in pain, pale in the face. Normally talkative, the teen was quiet. Back home around 7 a.m., Fales tried to get her daughter comfortable as she cried and moaned. She told Fales she needed to pee, and her mother helped her into the bathroom. "Mom, come here," she said from the toilet. Blood stained her underwear. The blood confirmed Fales' instinct. This was a miscarriage. At 9 a.m., a full day after the nausea began, they were back at Christus St. Elizabeth. Crain's lips were drained of color, and she kept saying she was going to pass out. Staff started her on IV antibiotics and performed a bedside ultrasound. Around 9:30 a.m., the OB on duty, Dr. Marcelo Tortorica, couldn't find a fetal heart rate. According to records, he told the family he was sorry for their loss. Standard protocol when a critically ill patient experiences a miscarriage is to stabilize her and, in most cases, hurry to the operating room for delivery. This is especially urgent with a spreading infection, but at Christus St. Elizabeth, the OBGYN just continued antibiotic care. Half an hour later, as nurses placed a catheter, Fales noticed her daughter's thighs were covered in blood. At 10 a.m., Melissa McIntosh, a labor and delivery nurse, spoke to Tortorica about Crain's condition. The teen was now having contractions. Dr. Tortorica states not to move the patient, she wrote after talking with him. Dr. Tortorica states there is a slight chance patient may need to go to ICU, and he wants the bedside ultrasound to be done stat for sure before admitting to room. Though he had already performed an ultrasound, he was asking for a second. The first hadn't preserved an image for Crain's womb in the medical record. Bedside ultrasounds aren't always set up to save images permanently, said Abbott, the Boston OBGYN. The state's laws banning abortion require that doctors record the absence of a fetal heartbeat before intervening with the procedure that could end a pregnancy. Exceptions for medical emergencies demand physicians document their reasoning. Pretty consistently, people say, until we can be absolutely certain this isn't a normal pregnancy, we can't do anything because it could be alleged that we were doing a abortion, said Dr. Tony Ogburn, an OBGYN in San Antonio. At 10:40 a.m., Crain's blood pressure was dropping. Minutes later, Tortorica was paging for an emergency team over the loudspeakers. Around 11 a.m., 2 hours after Crain had arrived at the hospital, a second ultrasound was performed. A nurse noted bedside ultrasound at this time to confirm fetal demise per Dr. Tortorica's orders. When the doctors wheeled Crain into the ICU at 11:20 a.m., Fetal stayed by her side, rubbing her head as her daughter dipped in and out of consciousness. Crain couldn't sign consent forms for her care because of extreme pain, according to the records, so Fetal signed a release for unplanned dilation in curettage, or unplanned C-section. But the doctors quickly decided now it was too risky to operate. According to records, they suspected that she had developed a dangerous complication of sepsis known as disseminated intravascular coagulation. She was bleeding internally. Frantic and crying, Fetal locked eyes with her daughter. You're strong, Nevaeh. God made us strong. Crain sat up on the cot. Old black blood gushed from her nostrils and mouth. And here is the mom at the side of her daughter, the graveside of her daughter. All right. It says, the law's on our side. Crain is one of at least 2 pregnant Texas women who died after doctors delayed treating miscarriages, ProPublica found. Texas AG Ken Paxton has successfully made his state the only one in the country that isn't required to follow the Biden administration's effort to ensure emergency departments don't turn away patients like Crain. After the U.S. Supreme Court overturned the constitutional right to abortion, the administration also issued guidance on how states with bans should follow Emergency Medical Treatment and Labor Act, or EMTALA. The federal law requires hospitals that receive funding through Medicare, which is virtually all of them, to stabilize or transfer anyone who arrives in their emergency rooms. That goes for pregnant patients, the guidance argues, even if that means violating state law and providing a termination of pregnancy. Paxton responded by filing a lawsuit in 2022 saying the federal guidance forces hospitals and doctors to commit crimes and was an attempt to use federal law to transform every emergency room in the country into a walk-in clinic. Part of the battle has centered on who is eligible for abortion. The federal EMTALA guidelines apply when health of the pregnant patient is in serious jeopardy. That is a wider range of circumstances than the Texas termination restriction, which only makes exception for risk of death or a serious risk of substantial impairment of bodily function. Just know that Ken Paxton got his way. They don't have to perform emergency care on pregnant women. They can let women die. And this is what the Republicans keep voting for. This is what pro-life women keep voting for. Pro-life women are voting for their own death sentences in Texas. And this will continue to happen as long as these forced birthers are in charge in these forced birther states. So this mom and that daughter, this is what aligned with their morals, and it's unfortunate, but we'll see if anything changes. Join the conversation. Let me know what you think. Don't forget to like, comment, and share.